Hello friends, welcome to my YouTube channel Nursing Classes, a place where you get all nursing competitive exam MCQs and theory classes. आज की इस वीडियो क्लास में हम जिप में नर्सिंग ऑफिसर एग्जाम 2012 का क्वेश्चन देखने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरे YouTube चैनल को सब्सक्राइब नहीं किया है तो प्लीज सब्सक्राइब करें और बेल आइकॉन पे क्लिक करें जैसे कि वीडियो अपलोड होने पर पहले नोटिफिकेशन मिले। और वीडियो अच्छी लगी तो अपने दोस्तों के साथ शेयर करें। चलो अब शुरू करते हैं। 1. First fetal movement felt by mother is A. Lightening, B. Ballotment, C. Engagement, D. Quickening. Correct answer D. Quickening. 2. Sequence of taking vital sign in a newborn infant is A. TPR, B. PRT, C. RPT, D. RTP. Correct answer A. TPR. 3. The mineral element which is essential for synthesis of thyroxine is A. Iron, B. Iodine, C. Sodium, D. Chloride. Correct answer B. Iodine. 4. Neonatal reflex elicited by touching the cheeks of the baby is A. Suckling reflex, B. Moro reflex, C. Startle reflex, D. Rooting reflex. Correct answer A. Suckling reflex. 5. Founder of modern public health is A. Nightingale, B. Phoebe, C. Louis Pasteur, D. Cerillet. Correct answer C. Louis Pasteur. 6. Deficiency of which of the following vitamins causes pellagra? A. Niacin, B. Vitamin B12, C. Vitamin D, D. Folic acid. Correct answer A. Niacin. 7. Another term used for superego is A. Conscience, B. Self, C. Ideal self, D. Subconscious. Correct answer A. Conscience. 8. Pacemaker of heart is A. AV node, B. Purkinje fibers, C. SA node, D. Parasympathetic system. Correct answer C. SA node. No. Making up stories to fill in the gaps of memory is A. Reaction formation, B. Confabulation, C. Lying, D. Sublimation. Correct answer B. Confabulation. Thus, hemiplegia is involves A. Paresis of upper or lower extremities, B. Paresis of both lower extremities, C. Paralysis of one side of the body, D. Paralysis of both lower extremities. Correct answer C. Paralysis of one side of the body. 11. Disulfiram is drug used in treatment of A. Mania, B. Schizophrenia, C. Hallucination, D. Alcoholism. Correct answer D. Alcoholism. 12. Normal head circumference in a newborn is A. 34 to 36 centimeters. B. 33 to 35 centimeters. C. 32 to 34 centimeters. D. 30 to 32 centimeters. Correct answer B. 33 to 35 centimeters. 13. What is the maximum volume that can be given IM injections? A. 0.5 milliliter. B. 1 milliliter. C. 2 milliliters. D. 6 milliliters. Correct answer D. 6 milliliters. 14. Rifampicin is used for prophylaxis of A. Malaria. B. Gonorrhea. C. Leprosy. D. All of the above. Correct answer C. Leprosy. 15. The diagnostic study to assess left ventricular dysfunction is A. ECG. B. Angiogram. C. Catheterization. D. Echocardiography. Correct answer B. Angiogram. 16. Verapamil is A. Cardiac glycoside. B. Calcium channel blocker. C. Beta adrenergic blocker. D. H2 receptor antagonist. Correct answer B. Calcium channel blocker. 17. Acid-base imbalance that develops in acute renal failure is A. Metabolic alkalosis. B. Metabolic acidosis. C. Respiratory alkalosis. D. Respiratory acidosis. Correct answer A. Metabolic alkalosis. 18. Clay colored stool is suggestive of da. A. Typhoid. B. Obstructive jaundice. C. Ulcerative colitis. D. Amoebic dysentery. Correct answer B. Obstructive jaundice. 19. Surgery done for myasthenia gravis is called A. Pallidotomy. B. Thymectomy. C. Hypophysectomy. D. Sympathectomy. Correct answer B. Thymectomy. 20. What is the effect of the cyclosporine in a patient undergone renal transplantation? A. Anti-inflammatory. B. Immunosuppressant. C. Antibacterial. D. Diuretics. Correct answer B. Immunosuppressant. 21. Normal glomerular filtration rate is A. 100 milliliters per minute. B. 125 milliliters per minute. C. 125 L. D. 2 L. Correct answer B. 125 milliliters per minute. 22. Parenteral preparation of potassium should be administered slowly to prevent A. Overload. B. Cardiac arrest. C. Respiratory arrest. D. Acidosis. Correct answer B. Cardiac arrest. 23. Causative agent of mumps is A. Toga virus. B. H. Influenza. C. Paramyxovirus. D. Bordetella. Correct answer C. Paramyxovirus. 24. Dose of acetyl salicylic acid is A. 500 mg per kilogram. B. 100 mg per kilogram. C. 50 mg per kilogram. D. 10 mg per kilogram. Correct answer D. 10 mg per kilogram. 25. Expected date of delivery for a woman whose LMP was the 15th of August is A. The 1st of June. B. The 24th of June. C. The 8th of May. D. The 22nd of May. Correct answer D. The 22nd of May. कैसी लगी यह वीडियो कमेंट करके बताएं। अगर अच्छी लगी तो अपनी दोस्तों के साथ शेयर करना। एंड डोंट फॉरगेट टू सब्सक्राइब। थैंक्स फॉर वॉचिंग। सी यू इन नेक्स्ट वीडियोस।